So this is the exam for the ulnar neuropathy. Ulnar neuropathy is a nerve. Most commonly is irritated at the level of the elbow. Occasionally it can be irritated at the level of the wrist, but much more commonly at the level of the elbow. So to evaluate for ulnar neuropathy, I actually first use my eyes. I inspect. So I have the patient do exactly what Kelly's doing. I have them just put their hand very casually on the table. If they have a claw hand, which is hyperextension of the MCPs, like this, hyperextension, and then flexion of the interphalangeal joints, the PIP and the DIP, just like this is a claw hand. Okay, I also have them put their palm down on the table. I tell them to separate all your fingers and then close them. If they're able to close them like this, that's a normal test. If when they close it, their pinky can't adduct, if it stays out like this, that's suggestive of an ulnar neuropathy. The next step I do is I take my paperclip and I do a 2-point discrimination test at the pinky. So I have them close their eyes. Do you feel one poke? Do you feel one poke or 2 pokes?
2.
And now?
1.
Excellent. Then I check strength. And the way I check strength is I grab my cards. I do what's called the ferment test. So I tell the patient, I want you to make a fist and hold this card and keep your thumb nice and flat. So make a fist, yep, just like this. And keep your thumb nice and flat. So nice and flat, the card, yep, just like this. And the two of us try to pull it apart. This is a normal, actually keep your thumb nice and flat. This is a normal test. If a patient has ulnar neuropathy, they end up flexing like this. And the reason is that the ulnar nerve is very weak and their ability to adduct their thumb is very weak. So they end up using muscles that are supplied by the median nerve, specifically the flexor pollicis longus, and it ends up causing their finger to flex, their thumb to flex. So they compensate doing this. So again, this is a negative test, and the positive test is this. That's the ferment test. After I check the ferment test, I then do the provocative maneuver. So I first locate where the ulnar nerve sits. This is the olecranon. This is the medial epicondyle. And right here is where the ulnar nerve, the cubital tunnel, where the ulnar nerve sits. And I basically find it and I percuss it. And it should cause tingling. If you have a positive ulnar neuropathy, the tingling will go down to the pinky and the ring finger. And then sometimes I flex to even irritate the nerve even more. And that is the evaluation for the ulnar neuropathy.